Morning everyone, I'm Liz and let's start with our presentation titled Humanju, Sociological and Health Aspects of Housing. First, housing is far more than just a place to live. It shapes social conditions and individual health deeply. It reflects social starts, community bonds, and access to resources. Um, while factors like safely coding and neighborhood quality directly impact well-being. Now, let's break down the two core aspects. First, the sociological aspects. Housing plays a key role in social structure and interactions. It reveals and reinforces social class difference and influences how we connect with neighbors, build social support, and feel a sense of belonging. Second, the house aspects housing conditions directly affect physical and mental health. Poor ventilation, sanitation, or overcrowding increases disease risks. While unstable or substandard housing raising stress, anxiety, and emotional strain. Finally, the relationship between these two aspects. Housing acts as a bridge between social structure and the main health outcome. Mm, Good housing fosters stable communities and equal resource access. While poor housing runs stress, illness, and social disadvantage.
Thank you, Li Zihan. I'm Yuan Zitao, and let's dive into particular examples and key debates. First, the affordable community housing case study by providing safe, affordable homes for low-income families. Communities strengthen social stability and the quality of life. Residents gain a stronger sense of belonging, benefit from reduced overcrowding, and experience less stress, making the whole community more connected and resilient. Next, the government's role in social innovation. Governments support housing-related social projects through policies, regulations, and funding. They reduce barriers with inclusive legal frameworks, incentive programs, and partnerships with the private sector and the communities, creating an ecosystem for innovative solutions. Now, a critical question is the link between housing quality and health an association or causation. Research confirms a strong association between poor housing and low well-being. The debate is whether poor housing causes poor health or poor health economic weakness forces people into bad housing. But the conclusion is clear. Upgrading housing directly improves well-being, so housing should be treated as preventive healthcare. Investing in it reduces medical costs, and health inequalities. Let's move to Zhang Jingwen for more in-depth analysis on affordability, ownership, and community.
Let's explore three key connections: housing affordability with health costs, ownership structure with mental health, and the community environment with overall health. First, affordable ability. Cutting housing costs often means sacrificing living conditions. Cheaper homes are more likely to be done, overcrowded or in unsafe neighborhoods. These hidden health risks lead to higher medical expenses that outweighs initial savings. Second, ownership and stability. Home ownership usually brings security and control, reducing stress and anxiety. Return, however, can involve uncertainty, frequent moves, and limited autonomy, harming mental health. But the key is stability, regardless of ownership. Third, the broader community environment. Health isn't just about housing quality. Access to green spaces, convenient transport, and strong neighborhood relations promotes physical activity, reduces stress, and fosters social support. A Malaysian study even found that public housing built environment, greenery, noise, safety, and neighborhood bonds links to depressive symptoms. This shows mental health is shaped by both housing and daily surroundings.
To finish our presentation, let's look at two important groups that help people get better homes: UN Habitat and Habitat for Humanity. First is UN Habitat. They work at a global level. Their main goal is adequate shelter for everyone. This means a home is not just a roof. It must be safe and have things like clean water. They believe that a good home is a basic human right and is the key to a healthy life. Next is Habitat for Humanity. They focus on real action. They use a famous model called threat equality. This means families help build their own houses. This helps them feel proud and strong. It's not just about building a house, it's about building a community and improving mental health. Finally, look at this picture. To make healthy homes a reality, we need everyone to work together. Global groups give the rules, governments give the money and laws. NGOs like Habitat help the poor directly. In conclusion, we want to change housing into homes. A home should be a place where people feel safe, healthy, and happy. Thank you for listening.